I'm Dr. Alibhai. I'm a naturopathic physician at Vitalia Healthcare. Today we're going to talk about PCOS or polycystic ovary syndrome. So you may have received a diagnosis of PCOS, or maybe you're experiencing symptoms that are pointing towards a PCOS picture. Some of these symptoms could include acne or unwanted facial hair or excessive body hair, maybe a delayed cycle length, so you're not getting your periods every month, it's taking a little bit longer, maybe every 2 or 3 months. You might be experiencing anxiety, maybe some blood sugar fluctuation problems, digestive problems. These could all be a part of the syndrome of polycystic ovary. So polycystic ovary or PCOS diagnosis can be confusing, and in order to understand it, it's important to understand where your hormones are at and how they're impacting your overall health. So in PCOS, your body is producing more of androgens, so higher levels of androgens. And the two main hormones are testosterone and DHEA. And yes, as women, we have testosterone as well, but in much smaller amounts. And in polycystic ovary, with these higher levels of testosterone and DHEA, this is what's causing symptoms. But I'm here to tell you that PCOS is manageable. So keep reading. You're going to learn about how diet and stress and inflammation is impacting your hormones and affecting how you feel, leading to symptoms, and how simple changes in your diet and in your lifestyle and in supplements that are tailored for you can help you manage your symptoms and balance and improve your overall hormone health. So keep reading to learn more about PCOS and how to manage your symptoms. Thank you.